Hello dear friends, welcome to PharmaGrid. In the last session, we have discussed about anxiolytic and hypnotic drugs. Today we will have a question discussion about anxiolytic and hypnotic drugs. Question number 1. Primidone used in the treatment of generalized tonic-clonic seizures is metabolized to. The options are phenytoin, phenobarbital, metformin, carbamazepine, none of the above. Here the correct answer is option B, that is phenobarbital. This primidone is a deoxybarbiturate which is metabolized to two active metabolites, which is phenyl ethyl malonamide, that is PEMA, and phenobarbital. Okay, so the two main active metabolites of primidone is phenyl ethyl malonamide and phenobarbital. Serum concentration of phenobarbital is used to monitor patients taking primidone. Next question. Lorazepam produces which of the following actions? The options are sedation, loss of memory, reduction of anxiety, all of the above, none of the above. Here the correct answer is option D, that is all of the above. We know that lorazepam is a benzodiazepine which produces all of the actions including sedation, loss of memory in the sense anterograde amnesia, and reduction of anxiety. Question number 3. Ultra short-acting barbiturates are used primarily as. The options are sedatives, hypnotics, antispasmodics, anti-Parkinsonian agents, pre-anesthetic agents. Here the correct answer is option E, that is pre-anesthetic agents. The rapid action and short duration of action make ultra short-acting barbiturates ideal for inducing anesthesia. The example for ultra short-acting barbiturates include thiopental and methotrexate. Next one. Barbiturates in general are particularly noted for. The options are lack of habituation, inducing microsomal enzymes in liver, instability, slow absorption, poor oral absorption. Here the correct answer is option B, that is inducing microsomal enzymes in the liver. We know that this barbiturates, especially phenobarbital, is a potent enzyme inducer. Okay, so they are among the most potent of the enzyme inducers. So this is one of the important feature of barbiturates. Flumazenil is a specific antagonist for which of the following drugs? The options are meperidine, prapoxifene, diazepam. Here the correct answer is option B, that is third option only, that is diazepam only. We know that diazepam is a long-acting benzodiazepine. Flumazenil is a benzodiazepine receptor antagonist. It obstructs the actions of benzodiazepines on the central nervous system and competitively inhibits the activity on the GABA benzodiazepine receptor complex. Which of the following activities are responsible for prominent sedative effects? The options are histamine 1 receptor antagonism, increased melatonin secretion, dopamine receptor antagonism. Here the correct answer is option C, that is 1 and 2 only, that is histamine 1 receptor antagonism and increased melatonin secretion. We know that melatonin is a hormone secreted by the pineal gland which is responsible for maintaining the circadian rhythm. Circadian rhythm means normal sleep-wake cycle. Okay, so this antihistaminic property as well as melatonin agonist, okay, are responsible for prominent sedative effects. So here the correct answer is option C. Increased melatonin secretion and antihistaminic effects are associated with clinical symptoms of sedation. Question number 7. Biotransformation of phenobarbital in the liver is catalyzed by. The options are by the oxidative phosphorylation complex, by the microsomal mixer function oxidases, in the hexose monophosphate shunt, in the gluconeogenic pathway, by the hepatic amidases. Here the correct answer is option B, that is phenobarbital is metabolized by the microsomal mixed function oxidases. Next question. The formula given above, which is the basic formula for barbiturates, they can be chemically classified as. The options are acidic, basic, amphoteric, neutral, lipophilic. Here the correct answer is option A, that is acidic. That is barbiturates are acidic in nature. Benzodiazepines may be indicated for all of the following except. Okay, so in the question they have asked about the exception. The options are restless leg syndrome, muscle spasm, anxiety, depression, acute alcohol withdrawal. Here the correct answer is option D, that is depression. Remaining all others are therapeutic uses of benzodiazepines which include restless leg syndrome, muscle spasm, anxiety, and acute alcohol withdrawal. Which of the following barbiturates is used as an intravenous anesthetic? The options are phenobarbital, amobarbital, thiopental sodium, pentobarbital sodium, methabarbital. Here the correct answer is option C, that is thiopental sodium. We know that ultra short-acting barbiturates have been historically used intravenously to induce anesthesia. In thiopental, in its structure, The keto group in the second position is replaced by the thio group, which increases the lipophilicity, thereby faster onset and shorter duration of action. So mainly ultra short acting barbiturates, which includes thiopental and methotrexate, are used as intravenous anesthetics. Which one of the following is a short-acting hypnotic? The options are diazepam, phenobarbital, chlordiazepoxide, triazolam, flurazepam. Here the correct answer is option D, that is triazolam. Short-acting triazolam is effective in treating insomnia. The risk of withdrawal and rebound insomnia is higher with the triazolam. Question number 12. Phenobarbital is a weak acid. To treat acute overdosage, you should recommend increasing urinary excretion with. The options are IV mannitol, oral doses of ascorbic acid, IV sodium bicarbonate injection, IV ammonium chloride, both A and C. Here the correct answer is option C, that is intravenous sodium bicarbonate injection. We know that phenobarbital is a weak acid. So in order to promote its excretion, we should administer a weak base. Okay. So for excretion, opposite medium is required. Here intravenous sodium bicarbonate will alkalize the urine to a pH of 7.8 to 8. In this pH, phenobarbital become ionized. It cannot be reabsorbed, so increase the excretion of phenobarbital. An active metabolite of anticonvulsant drug primidone is. The options are phenobarbital, dopamine, phenytoin, methotrexate, then trimethadione. Here the correct answer is option A, that is phenobarbital. The two active metabolites of anticonvulsant drug primidone is phenylethyl and phenobarbital. Question number 14. Of the following anti-anxiety agents, the one that possesses the greatest degree of antihistaminic action is. The options are diazepam, hydroxyzine hydrochloride, meprobamate, chlordiazepoxide, oxazepam. Here the correct answer is option B, that is hydroxyzine hydrochloride. Hydroxyzine is an anti-anxiety drug which also possesses antiemetic and antihistaminic effects. Next question. A 29 years old female patient is on phenobarbital for her seizure management. She is also taking oral contraceptive pills. What could be the possible after effect? The options are increased activity of phenobarbital, decreased activity of phenobarbital, increased activity of oral contraceptive pill, decreased activity of oral contraceptive pill, no effect. Here the correct answer will be option D, that is decreased activity of oral contraceptive pill or oral contraceptive failure will occur. We know that these barbiturates are potent enzyme inducers. Okay, so it will cause increased metabolism of co-administered drugs. Here it will lead to oral contraceptive failure. Which of the following medications would have the quickest onset of symptom relief in a patient presenting with generalized anxiety disorder? The options are fluoxetine, buspirone, lorazepam, venlafaxine, aripiprazole. Here the correct answer is option C, that is lorazepam. Lorazepam is a benzodiazepine. It produces symptom relief in general anxiety disorder within days to 1 week of treatment. Question number 17. Which one of the following statements is correct regarding sedative and hypnotic drugs? The options are diazepam and phenobarbital induce cytochrome P450 enzyme. Next option, phenobarbital is useful in the treatment of acute intermittent porphyria. Phenobarbital induces respiratory depression, which is enhanced by consumption of alcohol. Buspirone has actions similar to benzodiazepines. Benzodiazepines show analgesic action. Here the correct answer is option C, that is phenobarbital induces respiratory depression, which is enhanced by consumption of alcohol. Barbiturates and ethanol are a potentially lethal combination because of a high risk for respiratory depression. Only phenobarbital induces cytochrome P450 and it is contraindicated in porphyria. Okay, so in the first option they have mentioned that diazepam and phenobarbital induce cytochrome P450 enzyme. No, diazepam is not an enzyme inducer. Only phenobarbital is an enzyme inducer and these barbiturates are contraindicated in acute intermittent porphyria. Okay, so these options are wrong. So the correct statement is option C. Which of the following sedative hypnotic agents utilizes melatonin receptor agonist as the mechanism of action? The options are solpidem, esopiclone, estazolam, tazimilton, oxazepam. Here the correct answer is option D, that is tazimilton. Tazimilton is a melatonin receptor agonist useful in the treatment of non-24-hour sleep-wake disorder. Why nitrazepam is not used for the treatment of insomnia in elderly patients? The options are short duration of action, produce long daytime sedation, decrease risk of falls, short half-life. Here the correct answer is option B, that is produce long daytime sedation. We know that nitrosepam is a long-acting benzodiazepine. It should be avoided in elderly patients to avoid falls and fractures due to its sedative effect. Due to its long action, nitrosepam may cause long daytime sedation, or otherwise we will call it as hangover effect. So it is not useful, or it is not indicated in elderly patients. Question number 20. Which of the following anxiolytic drug is preferred in elderly patients with history of cirrhosis? The options are flurazepam, midazolam, lorazepam, chlordiazepoxide, triazolam. Here the correct answer is option C, that is lorazepam. Lorazepam is a short-acting benzodiazepine and it does not require phase 1 metabolism. Okay, so it undergo direct glucuronidation, so it is safe in patients with a liver disease, especially those having a history of cirrhosis. Drug-induced neonatal jaundice can be treated with which of the following drug? The options are alprazolam, phenobarbital, midazolam, baclofen, fluoxetine. Here the correct answer is option B, that is phenobarbital. Since phenobarbital improves the function of the liver, giving it to mothers just before birth may reduce the amount of bilirubin in the baby and thus reduce jaundice. This decreases the need for phototherapy and need for blood transfusion for the baby. Which among the following statement is correct regarding diazepam? The options are increase lifetime of chloride channel opening induced by GABA, has short half-life, increase the frequency of chloride channel opening produced by GABA, GABA mimetic action, there is no specific antidote. Okay, so here in the question they have asked about the correct statement regarding diazepam. We know that diazepam is a long-acting benzodiazepine. Okay, so here the correct answer is option C, that is increase the frequency of chloride channel opening produced by GABA. This is the mechanism of action of benzodiazepines, whereas increased lifetime of chloride channel opening induced by GABA is a mechanism of action of barbiturates. Okay, then diazepam is a long-acting benzodiazepine. Okay, so at high concentrations, barbiturates directly increase chloride conductance. Okay, so these barbiturates have GABA mimetic action, whereas benzodiazepines have only GABA facilitatory action. Next question. Which of the following statements are correct regarding lorazepam and oxazepam? The options are both have hydroxyl group at their third position in their structure, both have short duration of action, does not require phase 1 metabolism, safe in hepatic impairment, all are correct. Here the correct answer is option E, that is all of the options are correct. Highly polar group at third position enhances excretion of the drugs and thereby decreases duration of action. These drugs will undergo direct conjugation. That is, this lorazepam and oxazepam does not require phase 1 metabolism. They will undergo direct conjugation and hence they are safe in hepatic impairment. Okay, so all of these options are correct. Which of the given drug is a fused benzodiazepine? That is, which contains a triazole or imidazole ring? The options are triazolam, diazepam, midazolam, temazepam, A and C. Here the correct answer is option A, that is A and C. Fused benzodiazepines have triazole or imidazole ring in the second position instead of keto group. The examples include triazolam and midazolam. Question number 25. A 36-year-old male patient reports difficulty falling asleep for the past 2 weeks but needs to be able to wake up at 6 a.m. for work and doesn't want any daytime sedation. Which medication is best to recommend for the treatment of his insomnia? The options are temazepam, flurazepam, saliplon, buspirone, none of the above. Here the correct answer is option C, that is saliplon. Saliplon is a newer non-benzodiazepine hypnotic. It has the shortest half-life and duration of action. Buspirone cannot be used as hypnotic. Temazepam and flurazepam are long-acting benzodiazepines and have greater risk of daytime sedation or hangover effect. Active metabolite of chloral hydrate is, the options are trichloroethanol, oxazepam, temazepam, chlorbutanol, thiopental. Here the correct answer is option A, that is trichloroethanol. Following oral administration, chloral hydrate is converted rapidly to trichloroethanol, which is largely responsible for its hypnotic action. Next question. What is the maximum dose of chloral hydrate? The options are 5 gram, 2 gram, 500 milligram, 10 gram, 750 milligram. Here the correct answer is option B, that is 2 gram. This chloral hydrate is indicated for use as hypnotic for simple insomnia, rarely used for this indication. Usual doses 500 milligram to 1 gram per oral, 15 to 30 minutes before bedtime. For short-term use only, that is up to 2 weeks, and not to exceed 2 gram per 24 hour. Next question. Adult dose of lorazepam for treatment of insomnia. The options are 2 to 4 milligram, 0.01 to 0.05 milligram, 1 gram, 10 to 15 milligram, 500 milligram. Here the correct answer is option A, that is 2 to 4 milligram. Usual adult dose for insomnia is through the oral route 2 to 4 milligram orally once a day at bedtime. So with this question, we have completed the question discussion regarding sedatives and hypnotics. Thank you for watching this video. If you find the contents useful, please like and subscribe. Thank you. Have a good day.